This is Plant-Based Briefing, Preventing and Treating Erectile Dysfunction, or ED, by Thomas Campbell, MD, at nutritionstudies.org. And I'm Marian Erickson. This is the curated content plant-based podcast where I narrate articles related to plant-based and vegan living with permission in about 10 minutes or less every weekday. And I'm pleased to have permission from the Colin Campbell Center for Nutrition Studies to share their content. So now let's get to today's plant-based briefing. Preventing and Treating Erectile Dysfunction, or ED, by Thomas Campbell, MD, at nutritionstudies.org. If you're a guy interested in sexual intimacy and you happen to be a rabid health news follower, you might find yourself eating lots of certain foods at various times. For example, it might be dark chocolate, leafy greens, or if you're not inclined toward a plant-based lifestyle, maybe even oysters. Headlines trumpeting the sexual health benefits of such foods and beverages resurface periodically. A few years ago, you might have been loading up on blueberries and citrus fruits when it was reported that an increased intake of those foods was associated with the reduced risk of erectile dysfunction, or ED. Researchers followed about 25,000 men for 10 years and found that those with the highest intake of fruit had a 14% reduced risk of reporting erectile dysfunction. They found that flavonoids, a specific class of antioxidants found in abundance in fruits and vegetables, were linked to a reduced risk of ED. This is supported by animal research showing that quercetin, a specific type of flavonoid, improves erection firmness in diabetic rats. Given the good news about fruit and flavonoids, let me take this opportunity to highlight several important points regarding erections. They can be the source of endless middle school humor, but as you'll see, good erectile function is quite a serious matter. Number 1, there's a reason every third commercial seems to be about erections. Erectile dysfunction is extremely common. One survey found that about 50% of men over 40 had some degree of ED during the past 4 weeks or were taking oral medication for ED. Another found that 33% of men over 50 complained of having ED in the past 3 months. Number 2, older age, heart disease, high blood pressure, obesity, diabetes, smoking, alcohol and drug abuse, stress, and a sedentary lifestyle all increase your risk of ED. 3, blood vessel disease, the same process that causes heart disease, is one of the most common causes of erectile dysfunction. Other causes include psychological issues like depression and anxiety, medications, and nerve problems. 4, as much as 70% of all erectile dysfunction caused by non-psychological factors is due to blood vessel problems and diabetes. 5, if you just got ED, you may be headed toward the hospital for something much more serious in 2 to 5 years. Between 50 and 90% of men with coronary artery disease events, like heart attacks, reported erectile dysfunction before heart symptoms or events. In these men with heart disease events, heart problems were diagnosed 2 to 5 years after the onset of ED. 6, men with ED are 70% more likely than men without ED to die prematurely. 7, in a 2-year study, men with ED placed on a Mediterranean diet richer in fiber, beans, fruits, vegetables, nuts, and unsaturated fats had improved erectile function. And number 8, weight loss and exercise have been shown to improve erectile quality in men with ED. What might we take away from this? Think of the manliest scenes in American culture: downing meat, eggs, and protein to bulk up, sitting in front of a TV with chicken wings and pizza to watch the game, or grilling a steak while pounding beers. These manly activities may actually be the exact opposite of what your penis needs to be functional over time. Instead, to prevent and treat erectile dysfunction, step away from the steak, hot dogs, and chicken wings. Try some beans, fruit, and vegetables. Get off your butt and get your heart rate up regularly. When we look beyond pop culture and the dangerous stereotypes of masculinity, science tells us that those are actually the factors that make for the best sexual function over your lifetime. You just listened to Preventing and Treating Erectile Dysfunction, or ED, by Thomas Campbell, MD, at nutritionstudies.org. And I'm your host, Marian Erickson. And this is such an important topic. So many people don't know that ED is a warning sign for future heart disease. And if you haven't watched The Game Changers or haven't watched it in a while, I highly recommend it. There are some great segments about ED in that movie. And I have done a number of other episodes on the same topic as well, so I will link these in the show notes. 1106, From Bacon Lover to Vegan, My Unlikely Journey to Better Health. 1064 and 1065, Diet, Lifestyle, and Prostate Cancer. 755, new study, plant-based foods could improve men's sexual health after prostate cancer treatment. 602, how erectile dysfunction can save a life and be reversed. 583 and 4, what is cholesterol, how it works, foods to avoid, and the truth about HDL. 494, milk drinkers see 60% higher rates of prostate cancer. 473, lower rates of erectile dysfunction linked to plant-based diets. And 148, fight erectile dysfunction and 4 more reasons to go plant-based this November. So check those out and please share this episode with anyone who might benefit, and thanks for listening.